to begin by announcing some important developments in our war against the Chinese virus. We'll be invoking the Defense Production Act just in case we need it. In other words, I think you all know what it is, and it can do a lot of good things if we need it, and we will have it all completed, signing it in just a little while, right after I'm finished with this conference. I'll be signing it. It's prepared to go. So we will be invoking the Defense Production Act. Last week, I signed an emergency declaration under the Stafford Act, which, as you know, we invoked previously, and which activated FEMA's National Response Coordination Center. FEMA now is fully engaged at the highest levels. Today, FEMA is activated in every region. We are at level one being the highest level. This is a very different kind of a work for FEMA, but they will come through, as they always do. We have tremendous people, tremendous talent in FEMA. We're sending, upon request, the 2 hospital ships. They're being prepared right now. They're massive ships. They're the big white ships with the Red Cross on the sides. One is called the Mercy and the other is called the Comfort, and they are in tip-top shape. They soon will be. They're getting ready to come up to New York. I spoke with Governor Cuomo about it. He's excited about it. And I also, we haven't made the final determination as to where it's going to go on the West Coast. The Comfort is located now in San Diego, and it's going to be, we'll be picking the destination fairly shortly. So those 2 ships are being prepared to go, and they can be launched over the next week or so, depending on need. Earlier this week, the first clinical trial of the vaccine candidate for the virus began in Washington State, as you probably know. The genetic sequence of the virus was first published in January, but thanks to the unprecedented partnership between the FDA, NIH, and the private sector, we've reached human trials for the vaccine just 8 weeks later. That's a record by many, many months. It used to take years to do this, and now we did it just in a very short while. That's the fastest development in history of what we're doing with regard to the vaccine. We're making very, very big progress. Today, I can announce further steps to expand testing capacity. We're working with several groups to determine if the self-swab, a much easier process than the current process that's not very nice to do, I can tell you, because I did it. But we have a current process that's a little bit difficult. If you have it done, the groups are working on determining if a self-swab by an individual is as effective as the other. The other is very effective, very accurate. But we're going to see if we can do a self-swab, which is would be a lot more popular, I can tell you that. So, and that would be administered also by a health official, but it would be a lot easier to do. If it would test positive, the people would go and they would do what they have to do. But we think that's probably working out. I've asked the FDA to cut through the red tape and reduce regulatory barriers. We are looking at some very exciting things, and I'm going to be holding a second news conference either today. We're going to talk about the FDA. Some things are happening that are quite exciting, and we're going to be doing that either later today or tomorrow, fairly early tomorrow. So we'll see what happens. But the FDA, my instructions is I've been working very, very hard on a number of developments, and we'll be discussing them with you later today or tomorrow. And this afternoon, I'll be meeting with nurses on the front lines of the battle against the virus. They're truly American heroes. They want to get it done. They're incredible people. So we're going to be meeting with nurses, and I actually look forward to that. They're very brave. They're taking a lot of risk, and they have done an incredible job, and they never complain. Today, I'm also announcing that the Department of Housing and Urban Development is providing immediate relief to renters and homeowners by suspending all foreclosures and evictions until the end of April. So we're working very closely with Dr. Ben Carson and everybody from HUD. Every generation of Americans has been called to make shared sacrifices for the good of the nation. In World War II, young people in their teenage years volunteered to fight. They wanted to fight so badly because they love our country. Workers refused to go home and slept on factory floors to keep assembly lines running. And, you know, the numbers of ships that they built during World War II to this day has nothing like that has ever been equaled. They were doing ships literally on a daily basis. Nobody's ever seen anything like it. And to this day, nobody's seen anything like that, what they were able to do during World War II. And now it's our time. We must sacrifice together because we are all in this together and we'll come through together. It's the invisible enemy. That's always the toughest enemy, the invisible enemy, but we're going to defeat the invisible enemy. I think we're going to do it even faster than we thought, and it will be a complete victory. It'll be a total victory.
The President, as you all are aware, also announced today that by mutual consent, the northern border to Canada will be closed to non-essential travel. This does not include essential travel or the transit of goods, but it was through mutual discussion that took place this morning between the President and Prime Minister Trudeau, and the Department of Homeland Security will be effectuating that decision. With regard to testing, I'm pleased to report that we're increasing the number of tests being performed by the thousands every day, thanks to the public-private partnership that President Trump forged with commercial laboratories around the country. Our health experts tell us to remind every American, it's important to remember, people without symptoms should not get tested. Also, with regard to medical personnel, at the President's direction, HHS is issuing a regulation today that will allow all doctors and medical professionals to practice across state lines to meet the needs of hospitals that may arise in adjoining areas.
So, you know, we continue to look at data every single day. There are concerning reports coming out of France and Italy about some young people getting seriously ill and very seriously ill in the ICUs. We think part of this may be that people heeded the early data coming out of China and coming out of South Korea that the elderly or those with pre-existing medical conditions were at particular risk. It may have been that the millennial generation, our largest generation, our future generation that will carry us through for the next multiple decades, there may be disproportional number of infections among that group. And so even if it's a rare occurrence, it may be seen more frequently in that group and be evident now. So we're looking at that information very carefully. We have not seen any significant mortality in the children, but we are concerned about the early reports coming out of Italy and France. So again, I'm going to call on that generation that's part of that group that brought us innovations. They look for things that we don't see. We need them to be healthy. So again, not only calling on you to heed what's in the guidance, but to really ensure that each and every one of you are protecting each other. We cannot have these large gatherings that continue to occur throughout the country for people who are off work to then be socializing in large groups and spreading the virus. You have the potential then to spread it to someone who does have a condition that none of us knew about and cause them to have a disastrous outcome.
So yesterday, the President made a very important announcement about telehealth, and this is allowing our 62 million seniors to be able to get some medical services from the safety of their home, reducing their risk and without any copays. But we're also making sure that the healthcare system is prepared and that those on the front lines have the support that they need. The reality is the stakes are high, and we need to preserve personal protective equipment for those that are on the front lines of this fight. And to that end, we have put out guidelines over the last 2 weeks to expand the types of masks that can be used in routine care and saving those N95s for the most risky situations.
You've heard a lot about the fourth mission that VA has. Our first three missions are health care, benefits, and memorial affairs. Our fourth mission is to support the federal government in times of natural disasters and pandemics. We are the buttress force in case that FEMA or HHS calls upon us to deploy medical professionals across the country to meet crises. We plan for that every day. We are gaming out emergency preparedness scenarios, and we stand ready when the President needs us to expand our mission. Thank you.